Member for Vass.
Thank you, Acting Speaker, and I rise to move this motion and support this motion that this House condemns the McGowan Government for failing to deliver the services and appropriate levels of specialist staff to ensure all expectant Western Australian mothers can deliver their babies safely and close to home. And it is extraordinary that a state as wealthy as ours, under a government who had promised to ensure our hospital system would be battle ready for COVID, at this stage we are seeing such an extraordinary shortage of midwives, leading to a situation where services are effectively being cut. Because in a situation where mothers in a regional area are having to make a 10-hour round trip to have their baby, it is simply inexcusable. Midwives are being consistently asked to do more with less, and we hear this feedback from midwives as well, who raise real concerns about being asked constantly to do double shifts and up to 16 hours on occasion. And I'll read a quote from one midwife who has sent an email recently in May, 26th of May. I've worked in 3 different states across Australia. WA has to be the most ridiculous health system I've ever worked in. In 2022, they still use volunteers to provide primary emergency response. And I'll just finally, before going to other speakers, touch on the Women's and Babies Hospital, because the government will say in relation to this issue that not to worry, that they're building a new hospital, despite the fact it was announced 18 months ago, and in the budget there is just funding for a business case.